This abstract presentation is entitled Strongyloides westeri in the Republic of Ireland. This study was performed at University College Dublin by myself, Abby Kirtland, Conor McAloon, Nicola Walsh and Vivian Duggan. These are our declarations and acknowledgements. Strongyloides westeri has two parallel life cycles, one that is parasitic or host dependent and one that is free living host independent. Lyons et al. Showed in 1973 that the greatest source of infection for the young foal is via lactogenic transmission. Larvae have been seen in the milk of lactating mares between 4 and 47 days post-foaling. Embryonated eggs passed in host feces can develop into free-living L3 that will become parasitic either via oral ingestion or cutaneous penetration, or embryonated eggs can also develop into free-living adults, which can themselves then produce female parasitic progeny. Very little is known about the life cycle of these free-living adults. We don't know how long they live, how many times they can reproduce, or what kills them. Lyons et al. Have shown an increasing prevalence of Strongyloides westeri infection in central Kentucky from 1.5% to 30%. It is common practice for stud farms to administer peripartum ivermectin to mares with a specific aim of reducing Strongyloides westeri infection in young foals. In 1983, Ludwig et al. Reported a significant reduction in Strongyloides westeri infection following peripartum ivermectin administration. More recent studies have shown equivocal results. In the spirit of responsible anthelmintic use, the aims of this study were to determine the prevalence of Strongyloides westeri patent infection in thoroughbred foals on established breeding establishments in Ireland, with the hypothesis that the prevalence of Strongyloides westeri on these thoroughbred breeding farms may vary between years, to determine risk factors for Strongyloides westeri patent infection, with the hypothesis being that cumulative infection is a risk factor for Strongyloides westeri infection. And the third aim, to compare Strongyloides westeri patent infection in foals less than 100 days of age, born to dams that had and had not received peripartum ivermectin. The hypothesis here was that there would be no effect of peripartum ivermectin treatment of the dam on Strongyloides westeri infection in foals less than 100 days of age. The methods for this retrospective cohort study varied according to our three different aims. The apparent prevalence of patent Strongyloides westeri infection per year was determined using the first fecal egg count obtained from each foal using the McMaster technique. Limitations of the prevalence study included that positive infection was not quantified according to scale of infection. The model did not account for false negatives, and there was a compounding effect of year. Risk factors associated with Strongyloides westeri infection were determined using a mixed effects multivariable logistic regression model, with the presence or absence of Strongyloides westeri eggs as the binary outcome. Random effects were the dam, foal, and sire. Fixed effects were year, standardized day of the year, and age of the foal. The relationship between each continuous variable and the probability of infection was investigated by splitting the variable into quintiles and calculating the proportion of infected samples in each quintile. Variables with non-linear relationships were modeled using polynomials. A subset of the data in the above model was examined to include a comparison of peripartum ivermectin treatment of the dam, which occurred in 2018, versus no treatment, which occurred in 2019. Foal and dam inclusion criteria can be seen here. Table 1 shows the apparent prevalence of Strongyloides westeri infection in foals by year based on the first fecal egg count. As we can see, apparent prevalence varies according to the number of foals tested. One of the limitations of this study can also be seen in this table, whereby the median age at sampling is not uniform across the study period. A further limitation of this study is that the fecal egg counts were performed by lay personnel following a period of training at UCD Parasitology Centre, although questionable results were further verified using larval hatching techniques. Standardized increasing day of the year was identified as a risk factor associated with positive Strongyloides westeri infection. And this was seen irrespective of the year or the age of the foal. Further, a curvilinear association was identified between increasing day of the year and the probability of a positive Strongyloides westeri infection peaking in the month of May. Regarding our third aim, which was to evaluate the effect of peripartum ivermectin on the probability of positive infection when administered to dams in the predefined period of less than 30 days pre to 7 days post-foaling, we found that there was a negative probability of positive infection in foals born to dams that had been dewormed with ivermectin in this period, compared to foals born to mares that had not received peripartum treatment. However, we can see here that this finding did not achieve significance. It is important to evaluate this result in the knowledge that the foals themselves received blanket ivermectin treatment in 2018. However, in 2019, only foals with positive Strongyloides westeri patent infection received ivermectin treatment. In conclusion, the prevalence of Strongyloides westeri infection in thoroughbred foals on these breeding farms in Ireland does appear to vary by year. This may be explained by changes in stocking density. Cumulative infection was apparent over the season until May in this study population. Deworming the peripartum dam may not significantly reduce patent infection in the foal. Patent Strongyloides westeri infection in foals up to 48,000 eggs per gram was not associated with clinical signs. Given the consistent finding of the equivocal effect of ivermectin administration to the peripartum mare in other studies, and now this one, can we continue to justify the blanket use of ivermectin for the purpose of reducing Strongyloides westeri infection in foals? Are we achieving a benefit for the individual foal or the farm, or are we just chasing butterflies? More importantly, are we practicing or achieving responsible use of anthelmintics? Thank you, and I look forward to your questions.